It's not like unidirectional, but talk close to it so that everybody can hear you.
All righty.
In class.
The subcommittee will come to order. Welcome to today's hearing on the implementation of the Family First Prevention Services Act. After steady declines in the number of children in foster care, we have unfortunately begun to see an increase again. Both the data and the experience of those on the front lines indicate substance abuse, specifically opioid use and overdose, are a contributing factor. More than 3 years ago, this subcommittee set out to reverse this trend and do what Americans across this country expect of us. We work together, across the aisle and across the Capitol. Inspired by a desire to improve outcomes for children, we knew we had to strengthen families, whether they are biological, foster, or adoptive. We remained steadfast to the questions we were hearing from former foster youth, such as, why did you take me away? Why didn't you help my mom? Or why didn't you help my dad? Backed by research in the field, we set out to change the role of federal taxpayer dollars in foster care and adoption. We wanted to reset the incentives and focus resources earlier with upfront prevention services for substance abuse, mental health, and parenting for all families so fewer children would have to experience additional trauma of being removed from his or her home. We listened to advocates, researchers, states, providers, and most importantly, foster youth during the multi-year policy development process. For me, one of those voices was Nebraska's own Boys Town and Reverend Stephen Bays, where for more than 100 years, Boys Town has been helping children and healing families. Feedback from Boys Town helped us further our goal of providing the right kind of supports at the right time for each child in care. Now, 6 months after the enactment of the Family First Prevention Services Act, we return to talk about the implementation of this important law, again using those same voices to drive our questions today. To provide the answers, we are pleased to be joined by HHS Associate Commissioner for the Children's Bureau and lead policy official for the implementation of Family First, Jerry Milner. He brings with him more than 40 years of practice, management, and technical assistance experience in child welfare at the local, state, and federal levels of government. He has been a busy man over the last 6 months, traveling the country to spread the word about Family First and address outstanding questions. Thank you, Mr. Milner, for being here today and for all of your efforts on Family First. I also want to commend my home state of Nebraska for being on the leading edge of implementation and setting a strong example for others under the leadership of Dr. Courtney Phillips, CEO of the Nebraska Department of Health and Human Services, and Director Matthew Wallen of the Division of Child and Family Services, DCFS. In June, DCFS hosted a kickoff meeting marking the official start of the state's efforts to implement the act and included a number of child welfare stakeholders, such as judges, advocates, providers, families, and others often involved in the state's child welfare system. This type of cross-collaboration is precisely what Family First is all about and will create the type of positive systems change to improve outcomes for children and families for years to come. They also set up working groups on specific topics which need to be addressed under Family First, and those groups will be meeting regularly over the next few months to develop strategies for implementing Family First. Nebraska DHHS also created a website where the public can engage in the process of implementing Family First and monitor the progress. The use of technology also exists so their creative thinking families in the rural and sometimes remote areas of our state when it comes to providing prevention services. And they are thinking about ways to dovetail Family First with their existing Bring Up Nebraska initiative, which is a primary prevention program focused on developing nurturing communities to raise strong and healthy children. Every state is different and will have to chart its own course for Family First, but states like Nebraska, Oregon, and others are showing it can be done when everyone focuses on what is truly important, better outcomes for children and families. I now recognize the distinguished ranking member, Mr. Davis, for 5 minutes for his opening statement.
Thank you, Mr. Chairman. And before getting into my opening comments, I'd like to recognize my colleague, Congresswoman Karen Bass, who is here today observing our hearing. Congresswoman Bass is a tremendous leader on foster care issues and was a valued partner and resource throughout our efforts to enact this landmark change in foster care. I look forward to continuing to work closely with her and as we implement the law. And I might indicate that she also organized the foster care caucus that any number of us are members of. Mr. Chairman, thank you for scheduling this bipartisan oversight hearing. Child welfare is a deeply important issue to me and to the people of Illinois. I am grateful that we're working together so closely to ensure effective implementation of the landmark new law, the Family First Prevention Services Act, or Family First. Frederick Douglass was fond of saying that it is easier to build strong children than to repair broken men. There are very few places that this lesson is more evident than in our troubled foster care system, which has historically provided help only when it was too late to keep families together. When I asked foster youth what policymakers could do to make child welfare better, they almost always say, "You could have helped my mom and dad." That is exactly what we tried to do in Family First. I'm proud of our work together to enact this law to fundamentally shift child welfare from separating families to strengthening them. But our work is not done until children and families receive the help they were promised. That is why we hold this hearing today, and that is why we will continue our active involvement in its implementation. Family First provides a number of opportunities to strengthen families and build strong children. For families struggling with mental health, substance abuse, or parenting skills and challenges, it will provide uncapped federal matching funds for state services to address those challenges and to make foster care unnecessary. Importantly, these services are available to parents, children, and other family members. They are also available to youth in foster care who are pregnant and those who are parents, both mothers and fathers, to prevent the cycle from repeating. To trigger the federal investment in these services, states will need to develop prevention plans and provide a contribution. Child welfare advocates state that local officials and state legislators have told us they have a number of questions that need to be answered so that we can do that. We will ask their questions today, and we hope to get answers that will support positive action. Another aspect of the new law that is close to my heart is the opportunity to better support grandparents and other kinship caregivers. My congressional district has the highest percentage of children living with grandparent caregivers in the nation. We know that if children can't live safely with their parents, being with family is the next best option. But these kin caregivers need help and support. I commit to personally making sure that the new federal funding for Kinship navigators provides services to all grandfamilies that need them and that states update their policies to involve and support kin. The Department of Health and Human Services has already begun issuing policy guidance and soliciting applications for Kinship Navigator funds and regional partnership grants to address family substance abuse that will be available even before the permanent prevention funding. But there is a great deal of work to do. I appreciate Jerry Milner for being here with us today to answer our questions and his commitment to making the law a success. I look forward to working with the administration as we move ahead on their behalf of the families we represent. Thank you, Mr. Chairman, and I yield back.
Thank you, Mr. Davis. I would like to welcome our witness to the table, Mr. Jerry Milner, Associate Commissioner at the Children's Bureau and Acting Commissioner of the Administration on Children, Youth, and Families, and with the United States Department of Health and Human Services. Our witness is reminded to limit his oral testament to 5 minutes, and certainly your written statement will be included in the record. I would also like to remind our witness and members that time is limited today and that the topic for today's hearing is oversight of the implementation of Family First Prevention Services Act. While there are certainly many important issues we are all facing today, this hearing is part of a larger effort to make Family First a success by addressing outstanding questions that are holding states back from moving forward on this very important legislation. I would kindly suggest that if there is a veering off track, I will not hesitate to make sure that we bring the hearing back to its primary focus. With that, Mr. Milner, you may begin when you are ready.
Thank you, Chairman Smith, Ranking Member Davis, and members of the subcommittee. Thank you very much for inviting me here today to testify about something that is near and dear to me and the work that I've done over many years now. I also want to acknowledge the large number of former foster care youth who are in the room today, many of whom I know and have had the pleasure of meeting with over time. I unabashedly say that their voice gives me a voice, and it means a lot to me that they're here today. I began my career as a case carrying...
Just one moment, if you don't mind my interruption. A former foster youth and in the audience, would you raise your hand? Very good. It's great to have you here. And again, I apologize for interrupting, but your input is very valuable, and we're glad you're here. Please proceed.
Thank you. I began my career as a case-carrying social worker, and child welfare has frankly remained my life's work. Before joining the administration, my experience in child welfare included providing technical assistance to states to improve services to children and families, as well as serving as Alabama's state child welfare director. In more than 4 decades of work in child welfare, I've seen far too many situations where all the factors that place children at risk of serious harm went unaddressed by the child welfare system until a serious injury, psychological damage, or something much worse occurred. These things do not typically happen because of a lack of will or a lack of skill within the child welfare workforce, but rather because of the way our system has been designed and funded. Traditionally, the majority of federal funds have been used for foster care, and we spend only a tiny fraction in comparison of federal funds for actual prevention of child maltreatment before they become known to child welfare agencies. It does not have to be that way. I'm pleased to report to you that we have made significant progress in implementing the Family First Act, and we are absolutely committed to timely and effective implementation. By permitting for the first time states and tribes to use Title 4E funds to prevent children from entering foster care, the Family First Act provides a pathway for the child welfare system to help some families stay together rather than placing their children in foster care. Our approach to the Family First implementation allows for as much flexibility as the statute permits. We do not intend to regulate definitions of key concepts beyond what is already in the statute. We will also strive to provide maximum flexibility to states and tribes in claiming funding for prevention services. Our first program instruction to states and tribes was published on May 31st and addressed the amendments to Title 4B of the Social Security Act and the Chafee Foster Care Independence Program. Our program instruction on the amendments to Title 4E, the Foster Care Prevention and Permanency Program, was published on July the 9th. In order to participate in the new Title 4E Prevention Services Program, states and tribes will submit a plan to us that describes how the state will carry out the program. We will provide information to states and tribes on how to submit this plan in further program instruction that we expect to publish in the first quarter of federal fiscal year 2019. We are in the process now of procuring contract support to create the clearinghouse that will identify interventions that satisfy the requirement for reimbursement under the Prevention Services Program, and we expect to award a contract in the coming weeks. I also want to acknowledge a few of the implementation challenges that states and tribes are sharing with us, as well as other stakeholders in the child welfare community. We have heard concerns about the availability of the array of prevention services needed to be effective, about developing alternative placement options for children in congregate care who may not be able to succeed in a foster family home, about the expensive upfront cost of evidence-based programs, and about the time limits on reimbursable prevention services in light of wait lists and delays in getting families into services. Some states that have had the flexibility of Title IV waivers for quite some time are also concerned about the loss of that flexibility. While some of these challenges are undoubtedly very complex, we are committed to providing states and tribes with assistance to promote their opportunities for success, creating a child welfare system that we can be proud of as a nation, and one that children, families, and communities will see as a source of support and strength as opposed to a system to fear, will take collaboration across the three branches of government. We have a collective duty and a responsibility to ensure that federal policy and funding protects children to the best extent possible, which includes living in resilient, healthy families. I look forward to working with you as we continue implementation, and I'm happy to answer your questions.
Thank you, Mr. Milner. Thank you for sharing your insight and expertise. In preparation for this bipartisan hearing on implementation, Ranking Member Davis and I solicited questions directly from states and their representative organizations. In total, we received nearly 200 questions, and today we are going to do our best to get them answered so states can continue to move forward with the important task of implementing this important bill to strengthen families and improve outcomes for children. We heard states greatly appreciate the Children's Bureau's efforts to provide summaries and overviews through the recent program information releases, but state and local leaders request more specific information on timelines for policy releases and expected implementation milestones, both for the Children's Bureau as well as for implementing state agencies. We also heard human services leaders and child welfare administrators welcome the opportunity to implement a new vision for child welfare and to expand the continuum of services oriented toward prevention. In order to move forward with key decisions on implementation or delay, budget forecasting, workforce planning, community-based partner engagement, and state legislative activities, state and local leaders need of more concrete and regular communication and guidance from the Children's Bureau to facilitate implementation. Please tell us more about the timeline for upcoming guidance, what states can expect will be included and not included in upcoming guidance. Also, timelines for states taking action, submitting plans and the like, and for states that are delaying, how are those timeframes impacted? On the issue of state option to delay implementation for 2 years, the law is explicit that states have full control over their decision to delay implementation, but yet the program guidance mentions no less than 6 times approval by HHS and asks for a decision by November 9. There was no deadline requirement for this decision in the law, and by expecting a decision now for a year later appears to push states to make rushed decisions about these important reforms before thoughtful consideration and discussions can happen with various stakeholders, before the results of state elections allow new policymakers to make decisions about resource allocations, and before state and local budgets are finalized that would impact the state's ability to implement these reforms. I understand the November 9th deadline is not binding, but merely for planning purposes, and a state can change its mind at any point, both to go ahead or delay. Is that correct?
That's correct.
Thank you. On the topic of what families will be eligible for prevention, services, known as the candidate of imminent risk issue, I would like to highlight what you said in your written and oral testimony. The Children's Bureau does not intend to regulate a definition beyond what is already in law, correct?
That's correct.
Okay. Does this mean states should be setting out to define it themselves, and if they wanted to in the future, could adjust it?
Presumably so. States have flexibility under the current Title IV foster care program to make certain decisions about who is a candidate there. We want to give them that maximum flexibility there as well, and we don't intend to impose any restrictions on those definitions beyond what is already in statute.
Okay, very good. Can you reflect a little bit on the timelines that I mentioned earlier?
Yes, sir. I'm happy to. Let me first of all say we are absolutely committed to timely implementation, but we're also committed to doing it well. I am far more interested in seeing states truly move the culture and the foundation of their child welfare systems to one that is designed to strengthen families and gets the outcomes that Family First contemplates, as opposed to a purely technical implementation that may not, in fact, improve the outcomes for children and families. We issued our first information memorandum in April of 2018, which was an overview of the requirements of the Family First Act. Our second program instruction was issued in May of 2018, which covered the requirements under Title 4B of the Social Security Act. Our second PI was issued July 9th, I believe, which covers the requirements of Title 4E of the Social Security Act. We currently have in clearance a Federal Register notice which will be issued regarding the Family First requirement that we issue model licensing standards, and we'll be sending that information out for comment before finalizing that. We expect in the first quarter of federal fiscal year 2019 to issue additional program instructions for both states and tribes on the new 4E prevention funding program, which is part of Family First. In the meantime, I think it's important to note that while we recognize absolutely that states and tribes have a tremendous number of questions, as evidenced by the 189 that I received sometime yesterday afternoon. We are trying our best to be as responsive as we can to those questions going forward. Many of the answers to those questions have been addressed in the program instructions. Many of those questions are addressed in the statute itself. Where there are gaps, we are committed to issuing either clarifying instructions for states and tribes or meeting with them in order to answer those questions. We are participating and co-hosting with the Casey Family Programs a series of 3 listening sessions across the country to address state concerns, to respond to the questions. I participated in the first of those last a couple of weeks ago in Seattle. We have 2 more forthcoming. Even as we speak today, we have a state call being conducted to answer questions and to help respond to the concerns that states are raising with regard to the implementation of the Family First Act. And we have 4 more of those calls scheduled with states.
Thank you. On the model licensing standards, you expect that to be available when?
Very soon. It's in clearance right now. We have drafted that. Within the coming weeks, that should be out there and available for comment.
So well in time for states to run that through their respective legislative processes.
Yes, our deadline on that, I believe, is October 1 of 2018. We will come out with that before that October 1 deadline.
Okay. Thank you very much. I now recognize the distinguished ranking member, Mr. Davis, for 5 minutes for any questions he might have.
Thank you very much, Mr. Chairman. And Mr. Milner, thank you again. Starting October 1, 2018, the federal government will provide a dollar-for-dollar match for state expenditures for Kinship Navigator programs, which will help provide needed support to grandparents and other kin caregivers who have stepped up to keep children with their families and out of care. The law clearly provides this funding separately from the prevention funding, and it was Congress's intent that Kinship Navigator programs be allowed to serve all kin caregivers, not only those caring for children at imminent risk of foster care. This broader target population of kinship families is consistent with previously federally supported Kinship Navigator program funding in the Fostering Connections to Success and Increasing Adoption Act of 2008, which is referenced in Family First. Is it your understanding of the law as well that states should serve a broader population of kinship caregivers beyond simply those caring for children at imminent risk of care?
Yes, sir.
Thank you for that. Similarly, the requirement that 50% of interventions must meet the well-supported evidence standard only applies to the prevention services funding, not to the Kinship Navigator programs. The Kinship Navigator programs simply need to be evidence-based, which means they meet the promising standard in the law. Is that your understanding of the law as well?
I believe, I am clear that the Kinship Navigator programs must meet the evidence-based requirements. I am less clear in the moment about the 50% requirement there, but we'll be absolutely glad to clarify that for you.
Thank you very much for that. In your testimony, you said there might not be any models of Kinship Navigator programs that meet the evidence standard. What are you doing to make sure there are models available to states in time for states to claim funding in fiscal year 2019?
We will, well, first of all, to clarify that statement, we've heard from a number of stakeholders that there are not many, or possibly any, Kinship Navigator programs out there that would meet the evidentiary standards required by Family First. We believe that possibly there may be one of those programs that we have begun to look at that might meet those standards, and we're actually going to be pursuing that, hopefully, as one of our priorities in determining the evidence-based programs that are reimbursable under Family First. Apart from that, you mentioned the prior work that we have funded there. We're going to be looking at those programs for possible candidate programs in the Kinship Navigator realm that would that we could fold into the list of approvable services to be funded under Title 4E. We also work with our Office of Planning, Research, and Evaluation to fund a contract that is designed to build the evidence for promising programs out there so that we can expand that entire array of reimbursable services, and Kinship Navigator programs are a part of that work that's going forward.
And finally, Family First makes pregnant and parenting foster youth categorically eligible for prevention services even if their children are not at imminent risk of entering foster care. We wrote the language to ensure that this group of youth include fathers as well as mothers. Family First allows service provision on behalf of pregnant and parenting youth, meaning that services should be available to their kin caregiver. Does the HHS plan to emphasize these important points in its guidance to states to ensure that they know teen fathers and kin caregivers of pregnant and parent and foster youth can also be served? Absolutely.
The whole issue of responsible fatherhood and engagement of fathers in the lives of their children and families is of critical importance to us. It's been an area that I personally have been focused on through the Child and Family Services reviews since 2001, and we continue to work with states on ways to improve their response to that. I'm going to add that just a few weeks ago, I was fortunate enough to meet with a group of parenting youth who were either still in foster care or have emancipated from foster care, and a couple of those youth who are about to become parents. And that was in your home state of Nebraska, Chairman Smith. That group of youth gave me a tremendous amount of information about how important it is that they get the services that they need. And I'll also say that they gave me hope. They gave me hope that despite so many obstacles that they have faced, their goals were incredibly lofty. One of the young women in that meeting had strong desires of attending law school, and my special assistant who was with me there, who is also a lawyer, was able to meet with her and link her up with some resources that she could begin that whole process of living out her dream and her goal. So you are raising a critical issue here, and we are entirely supportive of providing as much of an array of services to that population served under Family First as we can.
Thank you, Mr. Chairman, and I yield back.
Thank you. I now recognize Ms. Walorski from Indiana.
Thank you, Mr. Chairman, and thank you, Mr. Milner, for being here. For all of you that came with him, thank you so much. Seeing your faces this morning gives me hope, and very tangible evidence sitting here today with all of you being here. Thank you so much for joining us today. The opioid crisis has put unprecedented strains on our communities and social service agencies. Indiana has seen a huge spike in the number of children in the foster care system, due in large part to this epidemic. I was proud to vote for the Family First Prevention Services Act because we needed to reframe the conversation and to put a greater emphasis on prevention rather than just treating problems as they happened, and to verify that children were being placed in quality settings. Mr. Milner, when it comes to accreditation of group homes, there is a lot of anxiety in my home state of Indiana. Part of that stems from the fact that Family First congregate care provisions, only facilities that meet the Qualified Residential Treatment Program criteria are eligible for federal reimbursement. In order to meet these criteria, a facility must be accredited by an independent not-for-profit accrediting organization. I think this is a great thing. This ensures quality. However, the anxiety kicks in when they look at the fact that the process takes 1 to 2 years to complete, and there's a limited number of accrediting organizations who will be facing a significant uptick in their workload. How are you planning to work with states to ensure these aren't negative impacts on service delivery?
Well, it's a tough issue, and in no way do I want to minimize the importance of that issue. Among the states that I talk to, tribal representatives, so many groups out there, that is one of the top 2 issues that I consistently hear about. We are meeting with the different organizations that could potentially be involved in this. I would be misrepresenting to you if I said we understand completely the range of possible accreditation options out there. We don't have that, all of those details worked out. But in our consultation with states, as we are hearing about their concerns, and I mentioned that we are in the process of having 3 of these listening sessions around the country, as well as 5 different calls, they are raising those concerns to us. We are committed to developing an implementation strategy and a plan that will, to the best of our ability, address those critical concerns for them. It is, frankly, a very big concern.
Would states with a pending accreditation be allowed to provide reimbursable services? And can any 4E funds be made available to assist providers in being accredited?
I'm not aware of any 4E funds that would allow states to use that for the accreditation process. I'm not going to speak definitively on that, but I can say that I'm not aware of that. And could you repeat your first question, please? I'm sorry.
Sure. Would states with a pending accreditation be allowed to provide reimbursable services?
I'm not aware of any flexibility in the statute that would permit that.
Are states able to identify accreditation standards apart from the national standards?
The standards would apply to the accrediting body.
Okay.
So the body that, for example, the Council on Accreditation and the Joint Council on something else, would probably have slightly different accreditation standards there. So it would depend upon the accrediting body, I believe, that the state chose to use.
Will standards defining trauma-informed program models be incorporated into those standards?
I think the statute does require that the programs, the qualified RTPs, actually provide services that are trauma-informed, so they would have to be a part of that process.
Great. Thank you, Mr. Chairman. I yield back. Thank you.
Thank you. I now recognize Ms. Sewell for 5 minutes.
Thank you, Mr. Chairman. First, I want to welcome our guest, Commissioner Milner, a fellow Alabamian, and since you went to both schools, War Eagle and Roll Tide.
War Eagle.
I believe members of both sides of the aisle saw the passage of the Family First legislation as a huge success. We all know that foster care placements are on the rise. In 2016, 3,769 children in my home state of Alabama, our home state, entered the foster care system, and over 36,000 Alabama kids were involved in an investigation of maltreatment. However, the Family First Act has provided states like Alabama with an opportunity to invest federal funds in preventive services that will keep kids out of the foster care wherever possible. Right now, Alabama spends about $54 million on foster care, but only one-fifth of that on preventive and permanency services. Under the new Family First law, this spending imbalance can be corrected, and states like Alabama can begin to invest more resources in substance abuse, mental health, and parenting skills training. However, in order for states to successfully implement the new law, HHS must provide the proper guidance and assistance to states, which leads me to my first question. When the Family First law requires HHS to identify national model foster care licensing standards and require states to report whether they have implemented them or not, the House has passed that provision 3 times that we should have, that the HHS should help identify national model foster care licensing standards. And the House has passed provisions 3 times, including voting for a separate bill, H.R. 2866. At the time that we were debating H.R. 2866, my colleague, Mr. Kelly from Pennsylvania, and I engaged in a floor colloquy to make very clear our intent that the National Association for Regulatory Administration model standards, which were the result of a multi-year effort incorporating input from key national associations and professional licensors, should be the foundation of such standards. I'd like to enter for the record a copy of the Model Family Foster Home Licensing Standards from the National Association of Regulatory Administration.
Without objection.
It was our expectation, Congressman Kelly and I, and our hope that after reviewing the model licensing standards, the states would modify their own standards to address any inappropriate barriers to licensing relatives caring for children or kinship caregivers, whom the child welfare system is increasingly relying on, often as a result of the opioid crisis. How will you encourage, or how will HHS encourage these licensing standards?
Well, first of all, let me say that we have reviewed the NARA standards. I personally reviewed the document that you've just entered into the evidence. We've also reviewed standards from other licensing bodies, in addition to state-specific and some tribal-specific licensing standards as well. We have put that information into our proposed standards in a Federal Register notice, which again is currently going through clearance. We expect and will strongly encourage states and tribes to respond, to give us comments, and others, not just the states and tribes, but the accrediting bodies themselves and others, to give us the comments before we finalize those rules and regulations. That's going to be forthcoming quite soon.
Sure. You know, regarding the 12-month limit on substance abuse treatment services and family-based residential treatment, what happens if a patient lapses, say, in the 14th month? I guess I'm trying to get at incidences where people will actually relapse after the 12-month period. Yeah. Clearly, while there's a 2-month gap, the reality is that that person still needs treatment.
Sure.
So what would happen for those who lapse beyond the 12 months?
That's probably, as far as federal Title 4E funding is concerned, I'm not aware of provisions where the funding for that service could go beyond 12 months. It is a very technical question, and I'll go back and be absolutely certain about that. Beyond that, I want to say that you have hit on a concern and a challenge that I think many states are raising to us. Not only for the fact that 12 months, while it is incredibly positive that we can now spend money up to 12 months for services that we previously could not do, with very serious cases of substance abuse, particularly with the rise in opioid use right now.
And the recurrence
Yes.
of that.
Yes,
I mean,
absolutely.
I think to me, I'm just trying to get to the point of future access
Yes,
to
yes.
treatment. And the reality is that maybe we should consider longer period. Thank you, Mr. Chairman, for letting me extend. And thank you, sir.
Thank you. I now recognize Mr. Reichert from Washington State.
Thank you, Mr. Chairman. Glad to hear that you stopped by the Casey family in Seattle. I've done a lot of work with them. I do have a question for you at the end of my 5 minutes, but I can't help myself. I've got to make a few comments first. First of all, I'd like to thank you so much for your service. I know that the young people in the audience today and those listening, looking at your record starting as a caseworker and continuing on all these years to help children, that takes compassion and dedication. I'm a 33-year veteran of law enforcement, and also, just for the information of the students or the young people in the room, I'm a survivor of domestic violence, the oldest of 7 kids, and a runaway. And I think you'll find that most of the people up here have a story to tell. And so when you look at us, we are people like you. We went through struggles and trials, and so I'm assuming that out of all the hands that were raised in the audience, I'm assuming all of you want to be members of Congress. Raise your hand, please, who wants to be a member of Congress? I don't see any hands, Mr. Chairman.
They may have higher aspirations.
How about President? Oh, there's one. Okay.
Don't do it.
Thank you. Yeah, don't do it, somebody said. And I just wanted to share that with you because this is, it's all real formal and everything, but we care about you, and we're here to try and figure out a way to help.
Absolutely.
Right?
Thank you.
So I look at this, and some have mentioned the opioid problem. It is just devastating our country and our children. And, the percentage of children entering foster care is due to, a lot of it, parental substance abuse and its dramatic increase. And in fact, every 25 minutes a baby is born suffering from opioid withdrawal. Every 25 minutes a baby is born addicted to opioids. Every 25 minutes. In Washington State, 5,700 children were placed into foster care in 2016. 34% of infants. 34% of infants. The passage of the Family First Law gives us an awesome opportunity to bend this curve. And we can do that. So this doesn't only get, this is not about just children. It's not only children, but it's about drug and alcohol abuse. It's about human trafficking. It's about crime. It's about keeping families together and keeping children safe and healthy. Keeping them in school then, right? They have a loving home and a loving family. Sure. They get educated. They get jobs. They're successful. They have pride in their lives and their families. That's what this is about, and it's about the success of America. And there is one agency in Seattle that I'm particularly close with because I have 2 drug-addicted grandchildren I was a foster grandparent and an adoptive grandparent, and they went through an organization called PIC, the Pediatric Interim Care Center in Kent. And what they do is they provide specialized 24-hour care for drug-exposed and medically fragile newborns. They offer treatment that allows the baby to completely withdraw from drug dependency and transition, and they want them to get them home safely without medication. They want to keep the families together, so they work with mom and dad if they're around and try to keep them together. If they don't, then they get adopted into families like my daughters and her husbands, and they become a blessing to all of us. So how can an organization like PIC, how can we ensure and be sure that programs like PIC are eligible for prevention services funding provided by Family First?
They're eligible. Private agencies have long been a foundational part of the service delivery system in the child welfare system in our country. Under Family First, the requirements to deliver services that are evidence-based will still be there. for the the private providers, but we are actively encouraging state child welfare agencies to work in strong collaboration with their partners in the public sector, the private sector, the rest of the public sector, the faith-based community, as well as other organizations.
So what's their process? And they got to be evidence-based, but what's the process, real quick?
Typically, they would have some sort of contractual arrangement with the state child welfare agency to be a service provider there. Yes.
Okay. I yield back. Thank you. Thank you.
Thank you.
Thank you. And next we have Ms. Chu from California.
Thank you. Last night I went to the Congressional Foster Care dinner that Karen Bass is the head of, and heard very wonderful testimony from foster care children or former foster care children who said how much Family First would change their lives and finally provide the resources available to keep families together versus letting more kids enter the foster care system. So I think this is certainly a step in the right direction. But states have a lot of questions about the implementation of this, and that includes my home state of California and my county of Los Angeles, which is responsible for the largest child welfare system in the nation, and in 2017 oversaw nearly 35,000 children. It currently has a 4E waiver, which has allowed them to provide innovative preventive services, including substance and mental health services, to populations who are not Title 4E eligible. But they've also done a dramatic job to reduce the foster care population 23% between 2007 and 2010, and they've also reduced the number of children in group homes and other institutionalized settings by 1/3. So I think they've been trying to do the same kind of goals that is in Families First, and they've also provided home visiting services, aftercare networks, created partnerships with other community agencies like job centers, and reduced the number of children entering care and increasing permanency. I understand, Commissioner Milner, that you had a productive meeting with LA County and about their program, and my first question would be whether you saw that they were making progress along these lines in a similar fashion to Families First. And then my second question has to do with the timeline for implementation and whether there can be any other kind of consideration for those who are in the Title 4E waiver programs, whether there can be guidance or technical assistance or any kind of other consideration for counties like Los Angeles to help them transition from their waiver to the implementation of the provisions of the Family First Act.
Sure. Let me say that thank you very much for raising that issue. It's a very important issue for me and for those of us in the Children's Bureau. Yes, I did have a very productive on-site visit with Bobby Cagle and his staff in LA County. I've also met with the Board of Supervisors for LA County to hear their concerns. Last week, spent a couple of days up in San Francisco visiting a community-based program, and have made visits down to San Diego as well. All of those programs have in common, I believe, a very strong commitment to moving their systems toward one that strengthens families, strengthens children, and prevents bad things from happening to children. LA County has done a tremendous amount of work there. The First Five work, which is a home visiting program, is one that they are really quite proud of. The loss of the flexibility of the Title 4E waiver dollars is going to be a big hit for the counties in your state, because the California, the state office, has pushed those flexible waiver dollars down to the counties, where they have used those dollars to create upfront primary prevention services for children and families, not just preventing them from coming into foster care, but preventing them from being maltreated in the first place. The transition to Family First means a lot of different things for them. It is the loss of the flexibility. Even though they are able to use Title 4E dollars now for certain prevention services, It does not replace the entire flexibility that they have under the 4E waivers right now, where they have a capped allocation and they're using that money accordingly. California has expressed great interest to me in some sort of a transitional authority to continue that, to help them make the transition in ways that they can be even more successful with Family First, rather than at a certain point just having to give up the flexibility that they've had. We would actually support that, and I believe that there is a strong need for us to do this in an orderly fashion, in a way that allows states to plan as carefully and as thoughtfully as they can to move to the new system under Family First.
Thank you so much for that answer. I really appreciate
Yes.
it.
Thank you. Now we move on to Mr. Wenstrup from Ohio.
Thank you, Mr. Chairman. Thank you, Mr. Milner, for being here today. Just in the scheme of the big picture, I just want to share that my wife and I have just recently experienced the joy of adoption.
That's wonderful.
And it is wonderful, and we'd like to see more of that take place. It's a beautiful thing. And Family First presents a real opportunity to shift kind of the way we think about the role of federal foster care dollars and how they can be more effectively spent. Our system in Ohio and Cincinnati area especially, very overcrowded. It's a real problem for the agencies, and we have this opportunity to provide alternatives for our youth, and I think that that's something that we all look forward to. We've been greatly affected by the opioid epidemic. Matter of fact, that's been a huge driver of the need for an increase in our foster care system to be able to work. But Ohio has held the Title 4E waiver since 1997. And so across the state, we are anxiously awaiting a timeline of how we deal with this transition from the waiver to Family First. We really need some guidance on that, and the sooner the better if we're going to be effective. We want some clarity on that. If you can provide it, and is there technical assistance? I'm following up on that question. But the sooner we can get a real timeline, it would be very, very helpful. And then the other thing that I'm concerned about is what is the process for states to identify and get approved new practices that are not specifically pre-approved?
Mm-hmm.
You know, how can we innovate in the areas of making this whole system work better?
Yes, absolutely. By the way, I was fortunate enough to spend some time with the child welfare leadership from Ohio last week. We had teams of 10 people from every state come here to Washington, which included not just the Child Welfare Agency, but the legal judicial community and the prevention partners. And it was a pleasure to be able to spend some time at the Ohio table, and also to hear some of their concerns. The process of getting services introduced into the approvable pool is going to be an ongoing process, as well it should. We will come out with an initial list of programs that we'll be reviewing, but Family First is inspiring a great deal of attention to building the evidence for programs out there, so that we hope to expand the array of services over time. States can submit to us programs that they want us to consider. Later this year, we will also, again, be issuing a Federal Register announcement that will describe that process for reviewing the criteria that we intend to use to review for programs that are reimbursable under the prevention funding stream, and also provide guidance for states to submit those programs if they want us to take a look at those.
So where are you on the stage in that stage right now? I mean,
I'm sorry?
Where are we as far as staging? You can submit an idea, an innovative idea right now. Do you have a particular form you fill out? Do you have to have documentation?
Yeah.
I mean, I think that's what we're looking for,
Sure.
and then the time frame of that.
Yeah. We will contract for a clearinghouse that will be responsible for carrying out those activities of reviewing the programs, soliciting nominations or candidates or whatever we want to call it for programs to be in that pool. We expect that contract to be issued by October 1. The procurement is on the street at this point. point, and I believe that we're on track for doing that. As soon as we get the clearinghouse in process, those procedures will be able to release and move forward with it. States could submit stuff to us right now. Clearly, we don't have the ability at this moment until we have the clearinghouse in place to actually conduct a review of those programs and start adding them to the bank. But we anticipate moving forward with that on October the 1st.
You know, some of the ideas that people come forward with, are they going to be able to test the waters a little bit? In other words, you want to have evidence-based ideas, if you will, preferably. Are they going to be able to test the waters, try something on a small basis, and then expand it if it's successful? Is that what we can look forward to?
I'm not sure if I understand the question. Certainly, an evidence-based program could be implemented on a limited basis. If you want to do it in one of your counties and perhaps not statewide, there's nothing prohibiting you from doing that. The statute is quite specific, however, that to be reimbursable under the prevention funding services stream, it must meet the criteria for evidence-based, either at promising, supported, or well-supported levels. I will add one thing, that our intent is to open the promising door as wide as we can open it, so that states can begin to use or continue to use services that they believe are effective in serving children and families, while they are continuing to build the evidence to get those services up to the higher rungs on the evidence ladder.
Thank you. My time has expired.
Thank you. Next, recognize Mr. Hood from Illinois.
Thank you, Mr. Chairman. And Mr. Milner, I also want to recognize and thank you for your service and your lifelong commitment to helping young people to succeed and all the good work that you do. And also want to acknowledge the young people in the crowd here today. Thank you for being here. Your presence is important, and we're honored to have you here today as part of this hearing. Prior to elected office, Mr. Milner, I spent a lot of time with the Big Brothers Big Sisters organization. I was a big brother myself in my hometown of Peoria, Illinois, and saw the really good work that has gone on there. And you know, many of our young people, through no fault of their own, are born into very difficult situations. And from a public policy standpoint, trying to figure out what we can do to help many of these good organizations. I've also spent time and served on a board locally, the Center for Prevention of Abuse, that works with young people that are affected by abuse and also domestic violence. And I'm happy that we're having this discussion here today. And let me get into a couple issues here. I guess when we think about strengthening families and the implementation of the Family First Prevention Services Act and how we can make sure that this is the most efficient and effective program possible in this country, implementing a major reform in the current system comes with its challenges. And I want to commend your willingness to be here today and answer questions about this implementation of the legislation and to make this smooth transition for our state and the local stakeholders. It's my understanding that HHS will provide a pre-approved, quote, clearinghouse list of evidence-based practices that the states will be permitted to use. Given that there are limited well-supported evidence-based programs that have been tailored for child welfare populations, there is a need for HHS to provide guidance on states conducting these program evaluations so that more evidence-based programs are established in the well-supported category and ultimately added to the clearinghouse list. Can you talk a little bit about what is the process for states to identify and have approved other practices not specified on the pre-approved list of the evidence-based programs?
Well, again, going back to Representative Weinsworth's question, we will come out with our final guidance on that later this fall once we've got the clearinghouse established and we have those procedures in place. I can't tell you precisely that they're going to fill out a form, we're going to respond in a certain period of time or whatever, but there will be a clearly defined process so that we can identify services that states and tribes want to use. As soon as we get the comments back on the criteria, the process, the priorities for reviewing those services, we'll be in a much better position at that point to guide states on how they can raise or elevate their services for consideration.
Additionally, Mr. Milner, is federal reimbursement available for evaluation activities of time-limited services?
The only funding that I believe Family First allocates for that is for us to use in terms of the clearinghouse and the technical assistance. $1 million, not a whole heck of a lot of money, was allocated for us to do that. When we have the clearinghouse in place, the clearinghouse will offer that level of technical assistance to the extent that the funding allows them to do that on evaluation and implementation of those services within the states.
Gotcha. Well, we look forward to working with you as a committee and wish you much success. Thank you.
Thank you so much.
Thanks. Next, I recognize Mr. Schweikert from Arizona.
Thank you, Mr. Chairman. Like Dr. Winstrup, we have an adopted daughter. Matter of fact, she's a third generation adopted now in the family, so obviously we're doing something wrong. Oh, come on. Can I walk you through, though, first, I know antidotes aren't policy, but they give you a little bit of a window. 3 years ago, my wife and I spent a summer getting certified to be foster parents. And we had, you know, folks from the state come as trainers. We had an agency. It was a trainer. It was very comprehensive, and sometimes the conversations were absolutely devastating and heartbreaking. A couple of the most stressful evenings I ever had with my wife were the drive home when we had foster families that had been in fostering for 20 years and the roller coaster that their lives were. We also heard repeatedly, particularly in a state like Arizona, there was a tremendous shortage of those parents, either those households that were ready to do short-term, long-term, older kids. So I guess I'm asking you, saying, okay, we've done a piece of legislation. There's all sorts of evidence-based, so we have much better math and statistics. There's some resources with it. Where's the greatest fragility you see out there in our society? Is it a shortage of foster parents? Is it a shortage of good data? Is it a shortage of resources to do intervention for substance abuse? If you had to give me 1, 2, and 3, overall, what's really missing out there in the system today?
I think we need to focus squarely on resolving the reasons that children need to come into foster care to begin with. I think that if we don't focus our efforts on the primary prevention of child maltreatment, we're going to continue to chase our tails. We're going to continue to be scurrying around trying to find more money in state budgets, more caseworkers, more lawyers, more foster homes, and we're going to continue to raise children in the foster care system who don't have all the skills they need to become healthy, productive adults.
Okay, you're actually heading in the direction, so child maltreatment. Yes. Is that parents with substance abuse? Is it households that have a mental health issue? Is it, I mean, and I'm asking for some granularity on, and I know this, and I'm not asking for antidotes, but I am asking for your perception.
I think it's all of the above. I think, quite honestly, many families, if not all families, could be at risk of having involvement in the child welfare system with a slight twist of fate. The most successful programs that I'm visiting out there, I could name them. Live Well San Diego is one of those programs, Center for Family Life. In Brooklyn, New York, the list goes on. They provide services that strengthen families before they get into the ditch of child maltreatment and trauma and can't get themselves out of that. It could be targeted to families that already have displayed some risk, but simply by strengthening families in communities and offer them a non-stigmatizing way to get the support they need, would go a long way.
And when we use language like strengthening families,
yes,
give me an actual example of what the program in San Diego is actually doing.
Addressing the protective factors of families. We know
So
that...
No. I'm asking you, what are they actually doing? They're knocking on the door? Are they demanding a drug? I mean, what are they actually doing that's so powerful that it reaches your top of your mind?
Over 300 partners have come together in San Diego, which includes the education system, the housing system, the transportation system, the Chamber of Commerce, Parks and Recreation, transportation, and, oh, by the way, the child welfare system.
They built a coalition.
Yes.
What are they actually doing?
They are promoting the notion of living well for the citizens of San Diego, regardless of what the particular entity is involved with. If it's the medical field, they address living well and in healthy ways
Here's
in
what
that
I'm
domain.
begging for your help, and maybe I'm just because I having done the foster care training. I have a household. I have these poor kids that are just living in hell. How is that system there protecting those kids? What are they doing that's so unique that protects those children?
I think that they're doing a couple of things. I think they're trying to help those families get the concrete supports that they need before they get to the living hell part of their lives. Okay. And that's where primary prevention comes into play.
We'll do some follow-up because I'd love to understand the tactical.
Sure.
And Mr. Chairman, I know I'm over time, and I may be an outlier here. I know we passionately want to keep families together, but I also passionately want to protect these kids.
Thank you, and we will begin a second round here as we do move forward. Let me touch a little bit on non-child welfare issues. Family First is unique because the expectation is for most of the services and interventions. The expectation is for most of the services and interventions to come from sources outside of the foster care and adoption agency. Therefore, it is essential for the Children's Bureau to take the lead and set an example for how to coordinate and collaborate with other agencies. How is the Children's Bureau working with SAMHSA, HRSA, Medicaid, and other HHS agencies on the development of approved programs that meet evidence standards to provide substance abuse, mental health, and parenting programs under FFPSA?
We have begun the process of having discussions with all of those agencies. HRSA around the home visiting, with SAMHSA, our policy folks are already in conversation with Children's Medical Services there, because Medicaid is going to be a tremendous interface between the work that we do. We have to sort out issues with Medicaid around payment for evidence-based services, payments in the facilities, how our board payments would interface with those. We are in the process now of compiling as many of the issues that we can become aware of that we know that we need to resolve. So we're in the early phases of that, but we are absolutely committed to working in partnership with those other federal agencies to make this a comprehensive implementation process. I am scurrying around from coast to coast, encouraging states to work in strong partnership with their local partners for implementation, and it would be hypocritical of me not to be doing the same thing at the federal level. I'll also add that it's not just those obvious agencies that we think we need to have strong partnerships. We are meeting with other groups that will have a tremendous impact on implementation, such as the National Governors Association, the National Association of Counties. I spoke a couple of weeks ago to the National Conference of State Legislators, and even this morning before I came here, was in contact with our Head Start agency to try to find those interfaces, particularly in some of the very rural communities out there where an array of prevention services is going to be hard to come by. So we're quite aware of that, and that is very high on our implementation priority list.
Thank you. Now, also, when will states know more about how to handle the billing situation, so like substance abuse services, where services are eligible for Medicaid reimbursement and Family First, and what is being done to reduce the potential for double billing?
That is further into the implementation process than we are right now. Once we are able to issue our guidance on the prevention services program, which will come again within the first quarter of federal fiscal year 2019, we'll be able to respond to those very technical questions.
because I think you can appreciate that states might be a little reluctant to move forward, knowing that they need to, but if there's concern that they may or may not be able to be reimbursed.
I do understand that. I don't think that the reimbursement procedures are going to be the criteria that states use to determine whether to go forward with the optional prevention services programs or not. I certainly hope it is not. I hope that they're thinking much more broadly about how they want to serve children and families, and that understand that we are absolutely going to work with them to work out those very technical details that we're nowhere near being able to respond to right at this moment.
Okay. How were programs previously funded under various HHS grants, such as the Regional Partnership Grants, Pregnant and Postpartum Women, McVie Home Visiting, Children Affected by Meth? How are they being consulted to provide input into this list of evidence-based programs?
We are absolutely taking advantage of the opportunity to look at the services that those programs have provided, particularly our regional program, regional partnership grants. I appreciate you bringing that up. That is one of our programs that we are absolutely proud of, particularly in the efforts to fight substance abuse issues within families. We believe that those programs give us a rich pool of possible interventions if the evidence base is there. If the evidence base is not there, they may also identify for us programs where we can focus efforts to begin building those building that evidence, because many of those programs have actually shown to be quite successful in getting to the outcomes that they were designed to get to.
Thank you. And now recognize the Ranking Member Davis.
Thank you again, Mr. Chairman. Commissioner, in your previous answer, you suggested that Health and Human Services will need to individually approve any intervention not in the clearinghouse. We had expected you would do that by approving the state plan that includes the intervention. Is that correct, or do you plan a different approval process?
Given the criteria that are set forth in the statute for an evidence-based program, we will have to review the actual program itself. Simply putting it in a state plan will not give us the information we need to know if it meets the criteria in the statute.
Following up on your answer to the chairman on candidate for care, I appreciate that in your testimony you clarified that HHS does not plan to define, and I quote, candidate for care or imminent risk beyond what is in the statute. Because the question is repeatedly asked in my state, I would like to know that other states are hearing the same question. Could you reaffirm that this means that HHS is not planning to issue a national definition of imminent risk or candidate for care, and will instead rely on states to explain their state standard in their prevention plans?
It is not our intent, as I put in my written testimony, to define those concepts any further than the statute already defines them.
Does HHS plan to issue any guidance or parameters for states to use as they explain their eligibility criteria in their state prevention plans? And if so, when will those be issued?
We will be issuing guidance on the Prevention Services Program later this year. We anticipate issuing that guidance within the first quarter of federal fiscal year 2019, and hopefully we'll be able to address those questions satisfactorily in that program instruction.
Does the Children's Bureau intend to publish program guidance for states about drawing down the Kinship Navigator match before the provision becomes effective? And if so, when?
We will produce guidance on the Kinship Navigator program that should include, that's getting a little bit more technical than I'm prepared for, but the guidance that we issue on that should cover any kind of billing procedures there. I can't imagine why it would not, but I'm not able to speak any more definitively than that.
Do you anticipate that a state would need to amend its 4E plan in order to claim Kinship Navigator matching funds?
I don't know the answer to that question. We'll have to get back with you on that.
Under state law or by law, HHS is required to provide technical assistance and disseminate best practices for providing and evaluating the evidence-based prevention services funded under Family First. Could you identify how this will take place?
We will be issuing guidance on the clearinghouse and that whole process in the first quarter of federal fiscal year 2019. And that, if I'm understanding your question correctly, that should provide the information that states will need.
Thank you very much, and I yield back, Mr. Chairman.
Thank you.
Thank you. Next, I recognize Mr. Reichert from Washington State.
Thank you, Mr. Chairman, and I want to kind of drill down into one of the issues that I mentioned in my first question, and that's human trafficking. And all of us on this panel, as I said, want to help our youth.
Absolutely.
And most of the young people who are out there on the streets and involved in this lifestyle have been victimized at home, sexually abused, mentally, emotionally, physically, and are driven to the streets and they're abused and victimized again. And then back in the day when I was working in the sheriff's office, they were victimized once again by a judicial system that really didn't understand that these young kids are victims, not criminals. Mm-hmm. Today we've been enlightened a little bit and discovered that we really need to help these young people involved in human trafficking. And the reason I know so much about this topic, you may or may not be aware of my background in law enforcement. I worked on a serial murder case for 19 years, called the Green River serial murder case. The person responsible for the murders in this case pled guilty to 49 murders. We think he killed 60 to 70 little girls and young women. I personally was at body sites of scores and scores and scores over those years. So, Family First allows federal funds for settings, providing high-quality residential care and supportive services to children and youth who have been found to be or at risk of becoming sex trafficking victims.
Yes.
The July 9th program instruction indicates that ACF will not further define that setting. Does the Children's Bureau plan to issue any guidance about the kinds of settings?
About the kinds of settings?
Yes, that this might entail.
I'm not sure I'm going to be able to answer the question completely on the types of settings. The law sets forth the criteria for a qualified residential treatment program. The accreditation body would also add to any of those requirements there. To my knowledge, we do not have intent of issuing any further guidance around those particular settings, but I'm going to say that somewhat tentatively. You are absolutely correct that we do not intend to define victims of sex trafficking or at risk of sex trafficking any further than that's already been defined in the law.
Well, I just think we need to take another look at that, and maybe you and I can have
Surely.
discuss. Since children in out-of-home care are already at increased risk of
Yes.
trafficking, this is going to be important for states to have a clear understanding so that they can use this placement setting appropriately.
I could not agree with you more. I've had several conversations with states myself around their intent and how they would like to define the terms of at risk of sex trafficking. I believe that states are coming from it from different places, but part of our plan also is to allow states that flexibility so that they can craft a program that will best meet the needs of youth in their states. I also just want to add, just for general interest, or maybe not, I visited one of those programs in your home state, in Seattle, a while back, and also was fortunate enough to be able to attend the ribbon cutting for a drop-in center there in Seattle, designed for youth who are victims of sex trafficking to have a place to go. So I've seen firsthand in your state the value and the importance, and talked to some of those youth myself about their experiences there. So we share that concern and that commitment.
I appreciate your answer. I yield back.
Thank you. I next recognize Ms. Chu from California.
Well, I have more questions from the state of California. In California, each county is responsible for administering its own child welfare program, and California is made up of 58 counties.
Yes.
As a result, the counties vary in capability and capacity and access to providers who can deliver prevention services. So Family First requires that the prevention component to the state's 4E plan must describe the target population for the services or programs. So my question is whether, of course, the state has to opt in for the Family First program, and do all counties and geographic locations have to provide the same level of prevention services, or can there be a targeting of those prevention services on a geographic basis versus having every county do every service?
Yeah, it's my understanding that, as you've said, the state has to make the option, take the option, but I do not have the understanding that every single county would have to provide the same level of service delivery. In the Title 4E waiver, which is admittedly a different program, you've got 4 counties in California that are providing those services, so it's not a statewide effort there. I see no reason why that could not be the same way in Family First, and frankly, would fully expect it to be that way. You have some very rural counties in California, as do the other members in their states. And the reality is, many of those prevention programs are going to be hard to come by in those very rural areas. So I don't think we can have a reasonable expectation that there's going to be a uniform level of service delivery across counties.
My other question is about the Quality Residential Treatment Program, or QRTP. Those provisions in the Family First program have time limits that the states have to meet in order to be reimbursed for such a placement. Now, right now, California takes more than 30 days to do an assessment as to whether a child should or should not be in one of these facilities, in a group home or a foster care home. I know that the Family First program is a step forward because there are some states that don't do any assessment whatsoever, so there needs to be an assessment. But my question is whether there is any flexibility on the 30 days in order for the state to be reimbursed, because it would seem to me that the best thing would be to have a good assessment. What if it's 31 days? What would be the situation with that?
The statute requires 30 days. I'm not aware of any flexibility in the statute on that.
How about this situation? Would a state be reimbursed if at the 60-day court review, the court disapproves the placement of the child?
I'm going to be going too far out on a limb to try to answer a question that's quite that technical. So we will have to respond to you in writing on that. I'm sorry.
And how about if a child moves from one QRTP program to another? Would a new 30-day assessment be required?
That's also a very technical question that I don't think I'm prepared to answer for you today. We'll get back with you on that.
Okay, well, submit those questions. And then I also wanted to ask about administrative costs. The requirement that 50% of a state's prevention services spending be related to services or programs it does not make clear whether there can be claims for administrative services like training and evaluation. So can administrative reimbursement for such things be in this program?
We'll also have to give you a written response on that. I can't say definitively what's included in the admin cost at this point.
Okay, I appreciate you getting back to me on that.
Thank you.
Thank you. Next is Mr. Winstrup from Ohio.
Thank you. Just a quick follow-up question, if you will. Our state is one where the county administers
yes.
the work. So in these states like that, can the local areas, just counties, opt in or opt out, or if a program's put in place, does it have to be statewide, or is there going to be that type of flexibility for the counties?
As I was saying to Representative Chu, I believe that states will have to work with their counties to determine where they're going to be able to offer some of the specific services. Whether there's a formal opt-in, opt-out, I wouldn't attempt to answer that for you at this point with any real confidence there. The state has to make the decision to be a part of the program, but then the state would have to work with its counties in order to determine how they were going to comply, particularly with the prevention services program. That's what I'm primarily speaking about right now. The congregate care provisions would not be an optional thing for a state, for a county to select from.
Yeah, I think we have to think about that because there may be initiatives that one or two counties really need, and the others don't.
Sure.
You don't want to waste money setting something up that another county doesn't need, but is needed somewhere else. So I hope that there is that type of flexibility that can take place within the state. So especially when they're being run by the county. You don't want to make them do something they don't need.
Yes.
But allow those that need something else to be able to do it.
And that is entirely consistent with the vision that we have for child welfare in our country coming from the Children's Bureau right now, in addition to a strong commitment to moving towards a primary prevention focus of our work. We believe that those efforts have to happen at the county and community level. The best examples that I see of programs effectively serving and strengthening families out there are not necessarily happening on a statewide level. They're happening in the communities where children and families live. That's where they can get the services and supports that are available to them in most situations that are culturally appropriate for them and that are responsive enough for them to sustain progress once they have made that progress.
Well, I've seen some of the benefits at a local level. One of my counties just went in addressing poverty was part of a short-term trial called Rural Impact. The caseworker had authority to make changes. I meet a family with 6 kids, and I meet the parents, and they're living in a one-room home.
Yeah.
And he said, I can't take a third shift job. I have nowhere to sleep.
Yeah.
So she gets them into a home with a couple bedrooms. They go to work.
Yeah.
The whole dynamic changed.
Sure.
It's that local level ability to fit what is needed case by case that I really hope we're driving towards so that we can really have a positive effect. And this is a situation where the person working with you, they're not just a signature on a piece of paper somewhere. They've been to your house.
Exactly.
They understand what's taking place.
Right.
Anyway, thank you. I yield back.
Thank you. Next, I recognize Mr. LaHood, Illinois.
Thanks, Mr. Chairman. Commissioner Milner, I wanted to focus a little bit on criminal background checks. And I mentioned earlier I was involved with the Big Brothers Big Sisters program, and I know when we were screening for Big Brothers and Big Sisters, I worked for 10 years as a state and federal prosecutor, and so we would do the background check for that. And obviously it's important that we make sure we have the best people that are involved in the child welfare system. I know, for instance, there's a clear standard set for foster parents and adoptive parents and the background check there. Can you talk a little bit about the proper oversight and enforcement for states and particularly for child care centers and whether there's a national standard that's been established and how that implementation happens, not only for criminal background, but for maybe other professional misconduct or drug use and where we're at with the implementation of that?
With regard to those background checks, the federal statutes address the criminal background checks, not necessarily the other areas that you might have some concerns about. We have long held a requirement that foster family homes, the adults in a foster family home undergo a criminal background records check. Family First adds a requirement that all staff of the congregate care facilities must now have that background check, which must include a check of relevant criminal databases that are out there. Although not necessarily the Family First Act, but other federal legislation does get very specific on what would disqualify someone based on a background check. States do have some flexibilities in terms of making exceptions to those rules, but they are required to have very specific procedures in place if they want to do that. I actually believe Family First is a giant step forward in terms of requiring the background checks with the congregate care facilities. I should note that we have had a requirement in place for some time that requires that they address something in a much more general way, safety concerns with regard to staff. And quite honestly, it's been one of those parts of our programs where we have found that states have not across the board done all that well with it. With a much more specific requirement under Family First, I believe we have a greater opportunity to enforce that through our review processes. The way that we would primarily review that from the federal level is with our Title IV eligibility reviews, where we would look at whether or not there was evidence that the criminal background checks had been conducted or not. And we'll be revising those procedures, those forms, and that whole process to comport with Family First as we go into full implementation.
And I guess thinking ahead with full implementation, so if there is a state that is deficient in terms of the standard and proper oversight
yes.
Or enforcement, what happens?
They're required to enter into a program improvement plan and make the correction. Typically, we're not able to withhold federal funds until they've had an opportunity to correct whatever the problem is. So we work with the states through our regional offices to develop a process for making the corrective action. If they are not able to comply with their plan, then they would be subject to federal withholding of funds.
Okay, thank you. Those are all my questions.
Thank you. I want to touch on another issue here, and then I'll certainly go to Mr. Davis for some follow-up as well. Maintenance of effort. We know that Family First was intended to supplement, not replace state efforts. Sure. And so the need to calculate the maintenance of effort is certainly there. Is the Bureau going to provide guidance to states in terms of how they can calculate their maintenance of effort?
Yes, we will.
And when can the states expect those?
I would anticipate that that's going to be a part of our program instructions on the prevention program itself. The MOE is specific to the prevention services program, and I would assume that that's where we would be able to cover that later this year when we issue that guidance.
Okay. And in terms of previous prevention expenditures, my understanding is that they are intended to mirror the services and populations that are allowable under Family First. Is that correct?
I'm not sure that I can actually give you a definitive response on that.
Okay, if you could follow up on
Surely.
that. Maintenance of effort is not limited to just funds that were spent in child welfare prior to Family First, because for non-waiver, state mental health, substance abuse, and parenting were not funded under child welfare. Is that correct?
Correct.
And for waiver states that may have been spending on substance abuse, mental health, and parenting, how do you see their calculating their maintenance of effort?
We're going to have to give you something more specific on that. I am not immersed in the maintenance of effort part of that. It's far too technical for me to be able to give you any hint of a satisfactory response, but we will give you something in writing on that.
Okay, well, I think all the states would appreciate that. And
surely.
Certainly there's, I know a great deal of interest on that. So with that, Mr. Davis, do you have any follow-up?
Thank you. Thank you again, Mr. Chairman, and I also thank you again for holding this very important hearing. It is my understanding that many Kinship Navigator programs have not been evaluated so that they can meet an evidence-based standard.
Yes.
What is HHS doing to support identification and development of additional evidence-based models for these important services?
I mentioned a little bit earlier, we fund a contract right now in collaboration with our Office of Planning, Research, and Evaluation that is designed to build the evidence for a number of programs that are out there. Kinship Navigator programs are a part of that effort. In addition to that, we are looking to the programs that do exist, and we've asked for comment on that, particularly in the Federal Register announcement that we just put out for evidence-based practices, for the criteria. In addition, we will be looking at the one program that we think might have an evidence base behind it to see if it comports with the criteria that are in Family First.
Congress provided appropriated funds so that every state could receive funding for Kinship Navigator programs now as a bridge to the Family First funding. The deadline for states to tell HHS their planned use of these funds was last week.
Correct.
Can you tell us how many states applied and how HHS plans to reallocate any funds which were not claimed?
45 states, 2 territories, and 8 tribes have indicated to us that they intend to apply for those funds. Since it's not every one of the states, there will be some balance that's left over, and we'll have to determine how we're going to distribute that balance of funds across those who do apply.
And my last question is that obviously home visiting is an evidence-based intervention which has been demonstrated to improve outcomes for pregnant mothers, parenting mothers, and fathers, and their children. In your work on the Evidence Clearinghouse, are you leveraging the McVie Clearinghouse, especially to find interventions appropriate for pregnant and parenting foster youth?
I'm unable to tell you specifically which clearinghouses we're looking at, but I can tell you that we're looking very broadly. We also recognize that the home visiting programs have shown a tremendous amount of effectiveness there, and we have every interest and every desire to make sure that they are accessible and available to states and tribes under the Title IV Prevention Services funding.
Thank you for being with us. Thank you, Mr. Chairman, for this very important hearing. And I yield back the balance of my time.
Thank you, Mr. Davis, and certainly thank you, Mr. Milner, for your participation here today. Please be advised that members will have 2 weeks to submit written questions to be answered later in writing. Those questions and your answers will be made part of the formal hearing record. Now, I know that there were several questions asked today that you'll need to follow up on. Sure. Can you say how long it might take for you to be able to follow up on these questions that were posed earlier?
If we have the answers, we should be able to get those to you without much of a delay at all. I can't tell you that we have even formulated the answers to all of those questions, particularly when it gets to things like maintenance of effort and what's going to be included in that. We're still very much in the process of consulting with states and with tribes. As I mentioned, yesterday we had a call with states to hear their concerns, to get their input. 28 states participated in that. One of those calls is going on today. 3 more are taking place. We have 2 more listening sessions in Atlanta and in Denver coming up in August. We have several sessions planned with the tribes to hear their unique concerns around this. I don't want to shortcut that consultation process and that very valuable input process by making all of those decisions without giving states and tribes full opportunity to share with us what their concerns are. So we may not have answers to all of those questions. And if we don't have answers, we'll absolutely let you know that and respond when we do have the answers.
Certainly, and I think you can appreciate the desire by the states and tribes to have timely responses. So with that, I want to say thank you again, and the subcommittee stands adjourned.
Thank you.